Smolko, and I am here on behalf of Puyallup City Council.
Hi, I'm Mayor Ned Witting, Mayor of Puyallup.
I'm Darius Alexander, and I'm the Director of Equity, Access, and Community Engagement for Bethel School District.
I'm Steve Decker. I'm the CEO of Family Promise of Puget Sound.
I'm Chelsea McElroy, Tacoma Public School Board Director.
My name is Kenneth King. I'm running for office, but also I am a crisis response specialist and a behavioral health specialist. I also work at Family Promise as the program manager for FCS services, Foundational Community Support.
Hi there, I'm Echo Abernathy, McKinney-Vento, and Foster Care Liaison in Bethel School District.
So a majority of the reason that we're here today is because of the fact that there's been so much misinformation being passed around. One of the big problems has been the fact that at other town halls and other public meetings and other public discussions, it's been stated that our community members that are unhoused are all drug addicts, are all mental health, and all deserve jail. And the truth is that everybody here, for the most part, is somebody who works with families or individuals or lots of other cases that are all high risk or already experiencing homelessness. And so one of the main things that we're going to talk about is all of these different expectations, but also the laws that are being misunderstood and misinformed and misdirected. And so I think one of the things that I'd like to hear right off the bat, if you're interested, because you're the McKinney-Vento specialist, right?
Yes, the liaison.
So we'll jump, the liaison. We'll jump right into the three from the school districts and hear about what you all are seeing in the field. And I'll pass it right to you, and then we'll go down since you have the mics over there.
Hi there. I can tell you to just talk about our largest category in Bethel School District is our doubled up families. And a lot of times I like to call this a ghost category because it's a category that's not recognized by HUD, but it's by far the largest. And this is our students and families who are living with others, no lease, and typically can be put out at any time. And so that is our by far our largest category. And then right behind that category is our unaccompanied youth, and those are students who are not living with a legal parent or guardian. These students are still accessing educational resources, still very interested in graduating, and are working with our team. We have a team of 4 in Bethel to get the resources that they need to make sure that they're coming to school every day. So I'll just speak a little bit on that. I'll stop and turn it over to the other team members that are up here that are going to talk a little bit more about homelessness and students that are experiencing homelessness. But realistically, a lot of our families are just, 1 meal away and maybe one conversation away from being back out on the streets, and that includes the children as well.
So really quickly before we jump into the next is that I want to do just a moment of explanation because of the fact that when we talk about doubled up is with an individual or a family is living with another individual or family, such as you might see somebody sleeping on the living room floor, borrowing or renting the garage, stuff that is not necessarily meant for actual habitation, but is only recently been considered homeless. All of our system did not actually count doubled up a few years ago, did not count living in your cars a few years ago and such like that. And so this is one of those data points that doesn't quite match when we're trying to figure out the full data of the situation because of the fact that it's only been added recently and we're still calculating all of that. Yes, go ahead.
I guess I'll come from the standpoint of kind of trying to humanize it a little bit and tell the story. So I just want to share a couple stories. When I first came to this department, I was blessed to work with Pastor Samara, and the way that came up was we had a family living in a car, and there were 2 or 3 elementary age kids. All they wanted to do was go to school and be able to belong. They were at safe parking, living out of their car. They had their dog in the car with them, and they wanted a shower. And the super cool thing was working with our superintendent to get those kids a shower, and just seeing the joy on their faces and the thankfulness of being able to get, my wife came and bought them some food, got them a shower, and they were able to go to school and just show up and belong. We were able to get them clothes. That's what homelessness looks like when we're talking about students and kids. Another situation we had when I was actually working in the schools was I didn't know what resources were all available. And I had a student who was graduating. Like, she worked so hard, got a full ride scholarship, had her housing and everything at college taken care of. And she came in and she bought her graduation announcements. And she said, I'm unaccompanied. I don't have a place to live, and I don't have anybody to give these graduation announcements to. And so I was just meeting her for the first time, and she gave me her graduation announcement. And then we were just going around the hallways giving them to random people because she didn't have anyone else to give them to. And that's what it looks like. And I think those things get missed a lot of times when we see people and we come up with these stereotypes. The last example I want to tell is about myself. Before I started working in education, I worked for an insurance company in corporate America for 12 years. Did very well, climbed the ladder, made really good money, and then I decided I needed to go work for purpose instead of chasing a dollar. And in that process, it was cool for a year, but I left a very good salary to work for a nonprofit organization, making $34,000 a year to take care of myself, my wife, and my 2 sons, and we lost everything. And in the process of losing everything, if it wasn't for my mom having another little mother-in-law suite, we would have been out on the street. And I think those kind of things are missed, especially in this economy and the world that we're in now. Sometimes we're one paycheck away from having to put our families out on the street or end up at safe parking. And I think those are just things we have to be able to tell those stories and show that human part.
And I think for me, I'd lean into the conversation around early learning. So I'm a preschool teacher by trade, and now I work as a child care program manager in the city of Seattle while serving on the school district, the school board in Tacoma. So with all these different varying touch points, we're talking about our youngest learners and our youngest community members. So prenatal to 5, so before they even really enter into our K-12 system. However, Bethel School District, Tacoma School District, we all have ECAP and Head Start services. And ECAP for years has counted that doubled up as homelessness. However, once the child transitioned from preschool into kindergarten, that data point was lost. And so those families that were experiencing houselessness or housing insecure, housing instability, as soon as they transitioned from that preschool year into the K-12 system, that a caseworker wasn't assigned, right? So in early learning, we have family support staff who go out to the homes or to wherever those people might be staying, and we find out, how can we help you? How can we get you those resources? How can we build your repertoire and what you need so that you can get on your feet? But what we've seen is there's a through line between housing instability in the early years to houselessness in the K-12 years, and then continued houseless adults who don't have the skill set, the resources, or the access to get the things they need. And so for me, I think my biggest background comes from working with those birth to 5, prenatal to 5, and those folks who are experiencing houselessness and how that trickles up in society. I think using our own stories as well, my mom was a single mom with 4 children, and so my dad decided he wasn't going to be there. So if he's not there and she's one person making less than $39,000 with 4 children with no support or help, how is she going to keep the lights on? There were many days the lights were not on. There were times where the eviction notice was on the door and she tried to hide it, but we can read now, so we know what's going on, but there's nothing we can do about it. There's no one you can ask at school who you think you can relate to, and as long as we were showered and bathed and clean and smiling, who was going to ask and see this family of beautiful children and say, oh, they must be experiencing a hardship? And so housing instability from childhood followed me through adulthood, and even now I serve on the school board. My first 2 years on the school board, I was making City of Tacoma minimum wage. I didn't know I wasn't going to get paid to be there, so I was doing all this community service work, and I'm coming home to my light shut off. I'm coming home to eviction notices on my door, but mind you, I'm on a school board. I'm in community. I'm in meetings. I'm showing up, and so no one will look at me and say, this is a housing insecure adult, because I'm also someone out in community providing resources to our youngest learners and their families of what houselessness might look like for them, while I am not even half a paycheck away from being houseless myself. And so I think when we have community conversations, we need stakeholders in the room. We need folks who are impacted in the room. It's bigger than having a table and having a chair. It's also providing the childcare so that that single mom can join the conversation. It's also about providing resources on site, having handouts and things like that. So I think some of the conversations that I've witnessed over the past 6 months have been really troubling. And so to sit here amongst folks who want to do the right thing and who know that we can be a part of that change and a part of that education gap for the rest of community, I just feel really honored to sit amongst folks who want to do that work.
So in this part, I want to have the three of you all at the same time. You guys can just chime in. I'll give you all the mic. I'll step back. I want the data, like what you all are seeing with the actual counts with McKinney-Vento, what you're seeing in the actual spaces that you're in. Is that okay?
I just pulled up a little bit of some statistics because Chelsea had touched on a couple of things. So this is, I'm going to go at the national level and then I'll bring it back down. So 1.3 million babies, toddlers, and young children under the age of 6 experienced homelessness in 2018 and 19. And I want you to remember that that data always takes a year or two to be completely caught up. So sometimes they have to look at the data, break it down, slice it, and bring it back in. But that just kind of gives you an idea of how many babies, toddlers, and young children are experiencing homelessness, to speak to your point. The other piece is that a lot of these kids are unaccompanied, so their parents might be incarcerated, their parents might have passed away. So we're talking about preschoolers who are not in the care of a legal parent or guardian. Maybe they're with grandma, maybe they're with grandpa, uncle, maybe they're with a friend or a neighbor. But these students still need access to these resources, and it's a very, very invisible population as we talk about, who really is out here experiencing homelessness. So that's one thing. We qualify on any given year about 900 students for McKinney-Vento services in Bethel School District. That can ebb and flow a little bit. I spoke to the fact that the doubled up is our largest category, and just to be specific on those numbers, let's see here. We qualified. We had about 61% of our population of that 900, so about 400 students, give or take, that qualified for doubled up services. And then 22% of that, right behind that, was our unaccompanied youth. And then behind that, we have students that qualify that live in cars. Chelsea had talked a little bit about that. A lot of times our students and families are not going to tell us if they're not really comfortable sharing that. They're not going to say, hey, we're in a car, people they're going to judge us. They're gonna question our situation. Are we going to be able to receive supports and resources? Are we going to have CPS called on us? I think that is the biggest thing that we hear from our students and families. I don't want to tell anybody. They're going to call CPS. Am I going to get in trouble? Am I going to lose my kids? So a lot of times the students that are living in those situations and the families that are in their cars or RVs are not going to tell us. Okay, the cars and the RVs, sometimes they're in decent conditions, but a lot of time in our district, we're in unincorporated Pierce County, as a lot of you guys know, these RVs are broken down. They're not working. They have to move them all the time. Because they're just not in a condition to be able to really be living in for any period of time. But it's a safe place. It's a roof over their children's head. And a lot of times our families are not educated on the fact that, no, you can totally have your kids in a car. You can have your kids in a tent. You can have your kids in an RV. Just let us know so we can connect you to resources and we can keep you safe and we can make sure that they are able to be fed, be clothed, and receive all the other resources and supports that a lot of you guys are providing here in this building today.
And I'll tag on that really quick. When we talk about the data, I want to make sure we might qualify over 900 kids, but we know for sure we have more than that. And it's also about, if I don't know the system, I don't know the system. When we lost everything, only thing I knew about McKinney-Vento is we had a right to go to school. Right, we were probably a year into it before my wife figured out that we can get all these additional supports and get a bus to come pick up my son and all that kind of stuff. But without that, that was a number that we missed. So that was 2 kids that were missed initially.
So for Tacoma Public Schools, we have served the largest amount of McKinney-Vento students in the state of Washington for the past 6 years consecutively. This year, we were passed by another district, and that's not anything that's worth noting in an honorable way. It's the fact of the matter that houselessness is spreading through the state of Washington because people are losing access and opportunity. The 2023-24 school year, we served 2,685 students that were registered through McKinney-Vento. And just like you said, there are so many students that are not registered through the McKinney-Vento program. And so in addition to the 26 85 students that we were serving. At 17 of our elementary schools, we were sending home over 100 bags of dinners every Friday. So there are families that are also in food insecure while dealing with housing insecurity and doubled up. So if they weren't registered officially through McKinney-Vento, through our family liaison process, we found those who also had some food insecurity. So McKinney-Vento, I think it spans people don't always necessarily understand the act that falls behind it. And I will leave that to the professionals to speak on the actual McKinney-Vento Act. But how I see it impact, it's also the transportation costs. So if a student is houseless, but their home school is a school in Tacoma Public Schools boundary, regardless of where that shelter they might be placed in Burien, they're still offered a free education. And so because their education is through the state of Washington, they're allowed to stay at their home school. But we've had kids as far as Burien and then as far south as Clark County still transporting to Tacoma Public School District because that was their school of the school of origin, yes, at the time that they became houseless or the time they reported houselessness before they were placed in a shelter system. And as most folks in this room know, the shelter system in Pierce County, there's not enough room. And the shelters that include children and families are even smaller. And specifically, like Darius was speaking to, when there's two parents in the household that is houseless. So you might see a shelter that will take one parent but won't take the other. So you'll see a fully homeless father and then a single mother in a shelter with multiple children at a time. And if they have more than two children, there won't be beds for them to stay together. If the children are over 11 years old, they might be separated from their family. So we've seen all of that, and then the taxi services and the cost. So it's been an enormous cost on districts, but it's also been an enormous loss to families. But if either one of you feel more comfortable speaking on the McKinney-Vento Act, because I know I don't know all the stats there, I just know it's heavily impacting.
I can definitely read the definition, and I can speak on what we do. Yeah, for sure. So the McKinney-Vento Homeless Assistance Act is a federal law that requires state and local education agencies to ensure immediate enrollment for homeless children and youth. And what that really looks like is you don't need to provide, first and foremost, you're not going to have a proof of residency. So you're not going to be able to say, hey, I have a lease, or hey, I have a utility bill, or even if you maybe are paying a little bit on that utility bill, it's not in your name. So students and families do not need to provide a proof of residency to be enrolled. They do not need to provide immunizations, which is great because a lot of times we lose that documentation when we are moving and we are in transition. So as liaisons, we know that our job is to have an intake discussion with you, find out what resources we can connect you to, and get you immediately enrolled. And Chelsea, she hit the nail on the head. Transportation sometimes. So let's say you lost housing in our district, then you still have a right to go to school in our district or in the district that you're residing in. But if I, have been going to Spanaway Elementary, for 4 years, my parents are probably not going to want me to move, and my whole community is around Spanaway Elementary. So let's say you're in, Lakewood, and you need to come out to Spanaway. We're going to transport you to Spanaway every day. And immediate enrollment is something that we just want to make sure that you're in quickly. We're going to get you in. We're going to make sure you have what you need. That might be connections to basic need resources. There might be medical care that you want to be connected to. That might be connected to Family Promise, a shelter, the safe parking program, okay? Because it extends beyond the educational piece of the work, right? That is what the McKinney-Vento Act covers, is that immediate enrollment. But we have so many partners and resources in community. When we're having this conversation with our students and families, we want to remove trauma, we want to remove barriers, and we want to try to meet as many needs as possible. So we start with the educational components, make sure you're connected with your school, your counselor, your social worker, you're enrolled regardless of what documentation that you have, and then we move on to the next pieces. Who can we get you connected to in community that's going to help to make sure that you are feeling that stability, that love, that care, and that you feel like you can go to school every day just like every other house student. That's what we always tell everybody when we're doing our presentations. We want our students, our unhoused students, to have the same experience that a housed student would have. So we do everything in our power to make sure that that happens. I'll go ahead and pass it to Darius to.
Yeah, the last data point I wanted to just mention is for our unaccompanied high school seniors. So in our district, we have one unaccompanied youth navigator, and that's only for the secondary level. And her caseload last year was over 100 students. The great thing about the work that she does and that our district does is the graduation rate for those seniors was 95%. The reason that's important is that's 100 kids. We already know that we're missing some, but also that is a grant-funded position. And with the reality of our world, if that funding goes away, so does that position. And then that's 100 kids who don't have that support. And then when we think about that 100 kids, that's also a great data point of 100 kids that are advocates to go talk to other kids who may have those same experiences.
So you notice that nobody here talked about adults for that moment, right? So I'm sorry, I was speaking into the microphone. I want to speak to you all. So one of the things is that you might notice that nobody here so far that spoke. No, I got to use this.
You can use both of them.
So that they can hear you.
Can y'all hear me? No, that's fine. I'll just speak directly to you. Nobody talked about adults in that 10, 15 minutes that we just spoke. We didn't talk about drug addiction. We didn't talk about jail. We talked about kids experiencing homelessness. Now, one of the things that was said was that only the kids that are registered in schools count for the McKinney-Vento. We have a ton of kids that are not registered in schools. When we talk about that, we're talking about minors that are not accompanied, that are not going to school, but we're also talking about families that haven't enrolled in their schools. Sometimes that includes kids that haven't gone to school yet, even though they're 11. Now, Steve is going to add some numbers on that, and then we're going to just have open conversation and reflect before we go on to the next section. The next section is going to be more about laws.
Okay, so first, the county-wide number. The estimate for McKinney-Vento right now is almost 6,000 kids county-wide, for all school districts included. Those are McKinney-Vento kids. They are in desperate need. That's only about 4% of the student population. 40% of the student population's families are one paycheck away from being on the street. If they miss one paycheck, they will be on the street. As of this morning, there are 95 families in vehicles or tents in Peirce County. That's almost 200 children. That's the ones we know about, because just as they've mentioned, families do not want to be found. They don't want to be counted. They want to keep safe with their kids, and they are terrified, and they move regularly, sometimes more than once in one night, just because something scares them off. The data shows that the heaviest number we see on the street are actually less than school age. Of the 200 kids that were on the street last night, 25% are less than school age. And what that means is how many more are there out there that are not talking about it? These are families that have called Family Promise to be on a wait list. The current wait list for families, if you lose your housing today and you have minor children, is over 3 months before there's room in family emergency shelter. There are not enough spaces available for family emergency shelter in Peirce County. Happily, the county is moving to change that. And as a matter of fact, we are opening another family emergency shelter near Parkland on the 1st of August. But that will hold 3 families at a time. 3 families out of 95. It's a drop in the ocean. It does nothing. When we talk about data on the family movement, what we're seeing is that when families come onto the wait list looking for simply a bed, emergency shelter, we're not talking, I want permanent housing, I want something, they're just looking for someplace safe for their kids to sleep tonight. We have a constant turnover of families leaving the wait list, but it's not because they get housed. It's because they leave. They straight up leave Peirce County and they just leave because there are no options. What other data point did I need to cover?
Well, that's good.
Okay.
Yeah.
Can you talk about that number, how it impacts domestic violence women? Because 3 months for a waiting list, that's nothing about like emergency services.
Yeah, before we go into the data, because Steve can do some of that, but I do want to point out that we're talking about 3 months of waiting list of them running back in, of our people running back and forth trying to find places to hide while actively fleeing domestic violence. I also want to point out that services for domestic violence in our area, in Peirce County, are sometimes limited to only those who left their house within the last 72 hours.
Yep.
So if we have somebody who is hiding out, and we've been called out by our partners out in the forest, if we have somebody who's hiding out in the woods for a week or two to try to hide from somebody, wife, husband, spouse, whatever, that is the perpetrator of domestic violence, after that week, they are no longer available to get some of those domestic violence services because of the fact that they were just too successful in sneaking away. Steve?
40% of the families are fleeing domestic violence. That's a lot of kids who are very scared and traumatized, and the trauma just keeps getting piled onto them as they experience this. That's only the families we know about.
This part, we're just having discussion before we go in. Matt, did you have a question?
Yes.
Or a statement?
I know a family right now that's kind of bounced between Peirce County and King County. They have a small child with them. I'm not sure if they have already enrolled their child into the McKinney-Vento program. I know you're in Bethel, correct?
Yes.
I just want to know, is there a deadline for students to register, or not at this moment?
For the McKinney-Vento program?
Yes.
There's no deadline. So enrollment and registration is ongoing for school districts, and McKinney-Vento is the same. Like, you can enroll and register at any time. Now, I will tell you that our busy season kind of starts in August, so that's when we're talking to all of our families, checking in with them, and resetting up transportation, because at the end of the school year, that transportation just ends, just because they're no longer in school for the summer. Unless they're in summer school, then we continue transportation, but we restart our conversations, and we talk with we talk with families throughout the summer as well, but the majority of the families are going to contact us in August. We're going to get them all set up for transportation. We start August 31st, so we start a little bit earlier, I think, than some of the districts, but families can always contact us at any time if they want to access McKinney-Vento services, if they think that they might qualify, or even if you want to, contact us and it's okay with the family, then we can reach out to the family as well. They don't have to come finding us. We will reach out to them, we will talk with them, and we will get them connected to the resources that they need.
Awesome. Yeah. Can I get your contact?
Most definitely.
Okay.
Just a follow-up and repeating the question, a family that's going between Peirce and King County, and they have a child who's not currently enrolled in school, possibly.
Yes.
And so I would say
No, they're not enrolled at the moment.
Okay, not enrolled at the moment. Our front line of defense, honestly, in Tacoma Public Schools are our office coordinators. My grandmother was an office coordinator for 39 years, and people really just get off a bus, stop at an elementary school and say, hey, I got a 10-year-old, and we've never been in school before. And that person typically will guide them to the process and get them connected with the right people at our central district, like the McKinney-Vento support and the foster and homeless liaisons. So there's so many different folks who are willing to do that work. The hardest time for McKinney-Vento families and for families in general is the summertime, because school buildings are closed and they don't know which libraries have extra resources and services. So there are some librarians that have libraries that have a social worker on site, but not all. Sorry.
So my question is, it's all about awareness.
Right.
So for these families that don't have access to the information that's available to them, how are you guys spreading the word? I heard Chelsea just said that the libraries have librarians who have this information. But if a family doesn't have access to getting to one of their local libraries, how are these families, these caregivers that are taking care of these children, how are they accessing this information?
I think it's an ongoing conversation. I'll just speak from the district level. We have over 21,000 students. And so we do ongoing training. Some of it's mandatory by the state. And then our team is just, since I've been in this department, we're just always trying to reinvent ourselves and trying to figure out how can we get the word out more? How can we prepare our teachers? I think the things that we have to also consider is, if you're a high school teacher, you have like 200 students. How can we make sure that we're supporting them? So what our team tries to do is making sure that we're out there just letting them know, first of all, here's what McKinney-Vento is. Here's how you contact us. Here's the rights that they have. But then even more than that, like that's paperwork, right? Then we have to train them on here's how you support a kid, because how can we expect a kid to pass a math test when they didn't have any place to sleep last night? So honestly, it's ongoing conversations, ongoing training, and really being intentional and thinking about a school year is 9 months long. So if we train them in August, we need to have more touch points throughout the year, because I'm going to forget when I have 2 kids fighting in the back of my classroom. So.
You mind if I expand on that too? Just to expand a little bit on that. So a couple of things is OSPI, which is, the educational agency at the state level that guides this program and all of the policies and processes that come down from the state level and federal level. We have posters, we have documentation, we go out into the community, we go out into churches, we're in bathrooms, we're at Safeway, we're in stores. We are required to have documentation posted with our information on it. So if you're anywhere within our community, then at some point at the library, you're gonna run into that information. I will say that in Tacoma specifically, Tacoma has a social worker. She's a good friend of mine. Her name is Sammy, and she's really, really dope. She worked for an organization called Building Changes. Building Changes, I talk a little bit about them because they do McKinney-Vento advocacy work. So they're talking about like, how many liaisons do you have in your building? Do you have enough funding? We are advocating for funding. So you have organizations that are nonprofits that are also advocating, also getting the word out about this at that higher level. In addition to that, Darius touched on it, we do trainings in all of our schools, and then we also have what's called a building point of contact. That building point of contact is usually the counselor or the social worker inside of each building, and that's that counselor or social worker that's going to know every student that qualifies for McKinney-Vento. McKinney-Vento is a program that it's protected, so not everyone's going to know that a student qualifies for McKinney-Vento, but that building point of contact will know their list. They're going to stay in contact with those students, and they're going to say, hey, Echo, I know you've got 900 kids on your caseload, but Jimmy needs a pair of shoes because his shoes are talking. He's coming and they have holes in them, and I need you a pair of shoes. And we have so many great organizations. One's called Soul for Souls. We get pallets of brand new shoes, and they're for McKinney-Vento students. And we make sure that our students know about those programs and our families know about it. So every year we're giving out shoes. But our family center where we're housed is open all year. It's a blessing. In Bethel, we work during the summer, so I am available. You can call me. Do I take some vacation for self-care? Yes, I do, because it is very important that the staff up here also take care of themselves so we can take care of others. But we're there. We're available. We're accessible. We get bread from Fran's Bakery every week. Families can come in and access our bread. They can access we have a limited food pantry, but we also have food banks here in the area. They're going to also have our posters. So there's a lot of different communication and touch points, but our partners, like Family Promise, like Safe Parking, the first thing they're going to do, Steve is going to have one of his staff call me and say, this student they just came here and they are now in Bethel School District. How can we get them enrolled? So our partners, it's so important that our partnering organizations know about the work that we're doing and that we have great relationships with them, because they refer all the time. We get referrals from Tacoma all the time. Well, they're down here at St. Vincent de Paul's, because you guys probably know St. Vincent de Paul's has a phenomenal center down there for supporting homeless students and families as well. We have someone from Bethel here. We get calls all the time. And when they call 211, they go, oh, call the family center. So the referrals come right back to us. Even sometimes we were like, 211, wait, I think that question was for you, but they referred them back to us. So it's kind of like this circle, but we don't want to give families the runaround. I do want to put that out. We want to reduce trauma. So it's super important that when I talk to that family, then I get them connected to those trusted partners that I know that are going to make a difference, that are going to, move this process along, and that are going to reduce trauma, not keep asking them their story, and we're gonna make things happen.
One thing I want to add on there is, now that Family Promise is the shelter access hub, every government entity in the county and the school districts are referring people to call Family Promise, and then we reach out to every MV team in the county and beyond, actually all 5 counties that we cover. But we are truly open 24/7 for any family in need, or any single for that matter, to call us and get connected to resources. So to your point, if a sheriff finds them parked out on the side of the road and asks them what the heck they're doing, that deputy will tell them to call Family Promise. If the fire department gets called to an RV fire, which happens unfortunately regularly, they tell them, let's call Family Promise now. And in some cases, they will drive them to our office in the middle of the night and drop them off, so that we can immediately start connecting them to services. We immediately connect them to the appropriate McKinney-Vento team in whatever school district of choice they're in. If they're not enrolled, we usually send them to Bethel, frankly, just in general.
We're here.
It's a great district, great resource.
They're closest to our building.
You're in our boundaries. It's a boundary thing, and I think that that kind of addressed your question, because you talked about King County and Pierce County. So when we would have a deeper conversation, I'd say, okay, well, where in Pierce County are there? Because Pierce County is quite big. Are we talking about Lakewood? Then that's probably Clover Park. Are we talking about Tacoma? Are they parking near Largemont? I'm from Tacoma, so I kind of know Tacoma too. So if you're like, oh, we're at Edison Elementary, I'm like, oh, you're in South Tacoma. Then technically your option would be South Tacoma, Edison, or the School of Origin. So I would ask you, what school what did they attend when they were last housed? So it may or may not be Bethel, depending on their story. But regardless, if it is Tacoma, then I'm going to go ahead and call up Christiane in Tacoma and say, hey, Christiane, I have a student for you. I'm making a referral. And then I'm going to directly connect them to that McKinney-Vento liaison in that district, right? Because that's what we do. We do warm handoffs. I'm not going to just give you a phone number, tell you to call, and good luck. No, I'm gonna get you connected to the right person. So.
Got it.
Okay, this will be the last of the school discussion.
Yeah, I'm almost done. I just want to add this piece, specifically, how do families learn about services? Birth to 5 or prenatal to 5 is our highest risk population. And prenatal to 5, they get information, one, directly from the hospitals. So if you end up in the hospital with a child who's under the age of 5, they will typically give you some resources for child care check, child find, things of that nature, if they think the child might have a developmental delay or whatever might be happening. So the hospitals are referring to early learning providers. Early learning providers are that first stopgap before we get down chronic issues of houselessness, food insecurity, and things like that. Because once you're in an early learning program, your child might stay all the way until they're 12 years old. We take them birth to 12 in the child care space, right? And so a really good child care provider is also going to have a list of resources. It is a Washington Administrative Code, or WAC, requirement that all child care have a list of resources. Now, is it always easily accessible? No. Do you always know exactly who to talk to? If that child care director doesn't have direct touch points with a school district, they might just call us cold because they don't actually have that resource on hand for themselves. But many of them do have a list of resources, a directory of sorts that they can refer families to. And so I really want to lean into that early catch. You have to catch kids early before it gets to a point before we're in school. So prenatal to 5 is really that touch point where you want to find out more about services and how to help yourself, how to help your family. And without those gaps in between, when we get to we're 10 and 11 years old, we haven't been in school, and we've been experiencing chronic houselessness, who was supposed to catch that? And so although teachers and childcare providers and caregivers and hospital staff are not those social workers, that's really the work that they're doing behind the scenes and at all times for children and family.
Lindsay, did you want to jump in?
Sure. This time I'll jump in, though, as a Bethel teacher. So I teach at Catherine G. Johnson Elementary School.
Bethel came hard this time.
We did. And I think part of it for me is thinking, I know who you guys are, and I still don't know everything that you do and everything that you represent. So one, of course, key piece is increasing information and access, but also decreasing stigma. And we're naturally, unfortunately, miserably up against other barriers now, like things like ICE. I know that a lot of my students they have that intersection of being unhoused or borderline unhoused, experiencing housing insecurity, and also happen to be Black or brown, and are very uncomfortable with a lot of things in our system. And so then the reporting may even be less because of these other horrific barriers happening in society. So as a teacher in Bethel, I think it would be really, really helpful. I'm not a classroom teacher anymore, I'm a specialist, but for classroom teachers, and even in my STEAM lab, I would love to have I would say, I'm no administrator, but I would mandate my teachers to have ongoing communication consistently in their newsletters, which is an expectation that all teachers have, of just an FYI box, and at open houses, and at any major school event or PTA event, that there be a booth that says experiencing homelessness or unhoused. Are you experiencing housing insecurity, and maybe put a definition of what that might mean, because some people might be experiencing it and don't even know what it's called. And put those things in multiple languages, of course, but just, I'd love to see a further reduction in the stigma, because everything you guys do is so awesome and so important, and I know it exists, and I still don't know all of the things that you guys can do and help with. So I'd like to help be a bridge between you all and classroom teachers if possible. I know I'm just one person, but I think we can do even more with just basic newsletter stuff too.
So one of the things that I heard being said there, just one note, and it came, I think, from you, from Echo, is that when we have individuals who are seeking assistance or seeking help, we can't judge them, right? We have to be like, okay, you were living in an RV, you're living in a car. That's okay, just tell us so that we can help you. Because as much as we want to put our own bias down, it doesn't matter. Our people have the right to live how they are, or have the right to live in a safe way until they can get to where they want to be. And sometimes safe is an RV. Sometimes safe is a car. Sometimes safe is camping for a few weeks out in the woods. We don't know what they're running from, but we know the monster that's chasing, right? When we talk about that, we also have to talk about the recent Grants Pass decision. And the Grants Pass decision is what you hear as the backing to every homeless ban that we're having right now. Because prior to the Grants Pass decision, we had a Ninth Circuit of Appeals decision that was Martin versus Boise. And that stated that unless a city or county or state had alternatives, we could not force people to not sleep in parks or in public spaces, because they're public use spaces and sleep is a life-sustaining activity, right? It does not matter if we're dealing with addiction. It does not matter if we're dealing with domestic violence. It does not matter if we are children or adults or senior citizens. We all have to sleep. If you don't sleep, you die. That's it. You might not die from the lack of sleep, but you're probably gonna walk off into traffic or something else. So when we understand that if you are being told to get up and move every time you lay down, you will become exhausted. You will die. That's it. That is what the Boise versus Martin, or Martin versus Boise Ninth Circuit of Appeals stated. That was overturned by the recent, what did I just say? Grants Pass decision, thank you. The Grants Pass decision stated that while, yes, sleep itself is a life-sustaining activity and it's a human right, the act of setting up a camp is not an activity that you have to have, and it's not one that the city or the state or the county has to abide by. It also stated that police officers are not connected, police officers or law enforcement are not connected to homeless services and therefore do not know if a county or town has shelter beds available. Based off of that, that is why we see places like Lakewood say, as long as there is a shelter within 60 miles, that means one's available, and we don't have to worry about banning homelessness here. They've changed that to 30 miles, but that's still 2-3 towns away, right? Does anybody want to, what's that?
Who's walking 30 miles?
Say it louder.
Who is walking 30 miles?
Ned, Lindsay, as city officials, do you want to chime in on this one so that I'm also respecting it?
I have so many notes, and those people
That's
who,
dumb.
if you've suffered through or experienced a city council meeting, please come, by the way, please come. We love to see people sitting there that we are actually engaging with, and please come and speak and keep representing all of the voices out there. But people are really sick and tired of us. I got into this business because I was sick and tired of politicians and by leaders who describe homelessness with passion or anger, and then they just keep talking about it, and there isn't a lot done. But the honest answer is that no city or organization can end homelessness alone, especially when behavioral health care, Medicaid, housing vouchers, major funding streams sit with all different levels of government. I had a couple of other statistics that just from Pierce County in 2025. As of January 2025, there was an 11% increase in, they say, homelessness in this definition, in shelters or outdoors in January 2025, as opposed to 2024. And there was also $215 million in housing and, again, homelessness-related investments. So what that tells me is that also back up one step, that $15 million was available for permanent housing, but it wasn't necessarily used that way. It was used for things like short-term fixes and activities rather than permanent solutions. And I would love to see that be used with more construction and permanent solutions. The problem is not that there's no money. The problem is that we have a fragmented, fractured system, and it's a lot of buck passing, and it's a lot of the right people in the wrong positions with too little power to do anything differently. So we need to have more people, whatever the issue is, more people, everyday average citizens, as my hero Stacey Abrams said, stepping up and being willing to lead. Those of you here, you're obviously willing to do that and demand a change and make suggestions for improvement, keep holding us accountable and people like us accountable to doing what we keep talking about doing. And most of the time, as I tell my constituents, you already have the answers. Inform me so that I can do my job better. And I know that too many people in government seats are great at talking and not super awesome at listening. And I do love to talk, but I try to listen 3 times as much because I can't do my job unless people tell me what they think we should do to solve these problems. The one thing I'll just say, top of my wish list is a Pierce County one list, one plan coalition. I know that that's something that it's not, I didn't invent that idea. It's been a thing that people have suggested, but like talking about how the police don't know what's available and where to send people, well, that seems like that should be letter A on a to-do list of things for any city government. Let's make sure that all of the stakeholders and all of the potential helpers are connected. And we have one list where if ideally, again, if I could wave a magic wand, we would have an anonymized list that somebody knew what the coding was, but every single person who is unhoused is on that list. And then there's a wraparound approach of what do they need? What's the biggest barrier in their way right now to being housed, and who can help them solve that problem? And then we're all pitching in together as opposed to just being so fractured and fragmented, so many amazing systems and programs. But I don't know that we're always talking to each other, and we are missing things and doubling things. And yeah, I think streamlining is maybe in order. What do you think, Mayor Witting?
We're definitely dealing with a fractured system, and we have umpteen organizations that are working on this problem, and they've all got CEOs or executive directors, and you know, in the private sector where I come from, the smaller guys get gobbled up because the big guys have got economies of scale that can make things work better and faster and quicker, and I see the opportunity to have people work together and bring things, bring better solutions to the table. The big organizations have CFOs that look at what's economically feasible, and you know, Pierce County's got $76 million worth of funding available to work with homelessness, and you know, it's awfully hard to get a good count on how many homeless there are, but if you said that's 5,000 homeless, you know, we've heard McKinney-Vento is more than that, but the funding stream for McKinney-Vento's comes from feds as opposed from the county, so I'm going to exclude those. But if we had 5,000 homeless folks, that's 15,000 people, $15,000 a person. You know, we ought to be able to do more than we're doing with that $15,000. We ought to be able to you know, there's cheaper solutions. I'm a big fan of Oxford House. Oxford House is providing housing to 260 people in Pierce County, and they don't charge a dime. They're you know, the people pay rent, and they put a lot of people in a house, so there may be 10 people in a house, but the rent's only $650, and that's the max. They don't charge anybody more than $650 a bed, a room. So, you know, if we can find those kind of solutions to take care of a fraction of our population, then we've got more dollars that we can use to spend to address more serious problems and help people get off addiction and move into more productive areas. So, it's, coming out of addiction is a really tough thing to do, and we need to have the ability to absorb those people back in to our society without, being in a shelter for 90 days and then being back on the street and going back. When something happens bad for somebody that's been unhoused, climbing out of being unhoused is a steep ladder, and if something bad happens as you're climbing that ladder, you don't just go back one step, you fall all the way down to the bottom of the ladder again. We just got to stop that process of having people fall back down again. We've got to catch them before they go down that far. Thank
I'd
you.
love us to catch them before they ever have to get a ladder to begin with. Be more proactive, because the most affordable bed is the one you never have to fill.
More preventative services.
Yeah, let's pay it, fix that car, let's get them, help them do
So-
some paperwork, pay an attorney.
So this is the part of the conversation where things are going to start speeding up. And I know we just kind of got here slowly, but this is now a game of hopscotch, right? We're all trying to get in, or double dutch, right? We're all trying to get in that rope and make sure we don't trip up. I want to point out, though, that I'm not the one who said that the police can't respond or are not supposed to have the information. That was the courts. But we can come back to that in a second. Matt?
Oh, I was gonna ask, New Hope Resource Center is the only area in Puyallup that offers like services within the city limits for folks experiencing like houselessness. I was wondering, would anyone from the council be willing to come down, during lunch hour? I go there every Wednesday, 11 to 1. They start 11 to 3, and we could really meet a lot of like these folks experiencing like houselessness and other crisis, and it'll be like more of like a face to the name of like what's happening, if that makes sense.
Yes, now that it's summer break and my personal stuff has settled out, let's do it, Matt.
Yeah.
Wait. Okay, so really quickly, because I want to lead this right into the next topic, and the next topic is the fact that we are now doing the regional approach, the unified regional approach. So when we talk about there only being one service in Puyallup, we're actually talking about New Hope coordinates with several other service providers.
Yes.
But we're pulling those from other areas, and we're just about to enter a new phase where we're going to start actually using this to make a bigger network that also ties in to Lindsay's comment about a unified list. And when we talk about the unified list, I'm going to leave that one up to Steve.
Okay. Just so you're aware, there are lots of agencies directly providing services in the city, not just New Hope.
Sorry,
You just don't know about them, or they don't have a physical building, but there are many, we're one of them, so I know there are services going on out here. When we talk about this concept of the unified list, it's one of the movements that the county's pushing hard on right now is called the Unified Regional Approach. And it's an idea that all of the government entities, counties and cities, work together on one systematic solution for Pierce County. Part of that depends on having a single list of who needs help and what help they need. A list is great, but if it's just a list, it doesn't do anything. One of the things that has got to change is how we think about working with people out there. A unified approach says that when someone calls in to Family Promise as the shelter access hub, yes, we get them on the list, and we have I've got 10,000 residents of Pierce County right now on that list. I have probably the largest data set of people in need in Pierce County today, and you have to do something with that. And do we reach out to them? Do we send out text messages? We send out a weekly follow-up with every single family on the wait list and say, what's happened this week? Where are you at? What do you need to do? And then we work with them on a new case plan for the next week. And that's great for those 95 families, but we got 10,000 people in Pierce County that have called us for help, And it has to happen with all of them. Well, that won't happen unless everybody's involved. And the concept of a unified stream already exists elsewhere. This isn't a new idea that Pierce County came up with. There's a movement nationally called Built for Zero, and that concept is all of the parts that are evidence-based that are shown to reduce homelessness and get more people off the street and shorter times sleeping rough if they have to. And one of the prime Built for Zero concepts is a single reference list. One single list that everybody can work from. If you look at Kitsap County, they are doing it very well. They have one organization that takes all incoming calls, and then they send them out as appropriate to every organization in Kitsap County that needs help. King County has a single entrance point, and they just made the news for very bad things. So there's two examples right next door on how to do such an approach. I think if it's done correctly in Pierce County, it will be a game changer, and it will save people's lives, and it will impact it. But we have to realize that just saying there's only one entrance point doesn't do anything. We have to think about what goes with that. The entire reason that Pierce County is releasing funds specifically to expand emergency family shelters is because we've shoved down their throats so many times the data on how many kids are on the street, because they didn't have that number. Pierce County only gets 4% of the federal dollars that a county of its same size elsewhere in the U.S. would get for support of homelessness. The federal dollars are not coming here because Pierce County doesn't have the data to prove the need. This city does not have the data to prove the need. That is an issue, and you can't get more funds, more opportunities, more services unless you prove the need first. A single data set is a big step in the right direction there.
So when we talk about data sets, one of the things that you all have heard was McKinney-Vento. You've also heard the service count that Steve was talking about. We've also have other counts such as through CMAR and through community health. These are service counts for people who are seeking out health care but still experience homelessness. Now they'll have a check somewhere on their profile stating that they have experienced homelessness or are currently experiencing homelessness. We have a set data collection here in Pierce County called HEMIS, the housing, what's HEMIS?
Homelessness Management Information System.
McKinney-Vento does not necessarily go into HEMIS. CMAR and healthcare, or the healthcare counts do not necessarily go into HEMIS. If an organization specifically states that the only thing that they do is homeless services, such as a faith-based organization or a private organization, they don't necessarily put that data in HEMIS either. At some point soon, we're going to have to start collecting these data points and putting them together so that we can have a bigger picture, because right now we've got a broken mirror of a bunch of different chunks of what this problem looks like and what our people are going through. Because every time they access a different place for a different service, they're going on a different list.
Do you mind if I speak to that just a
Absolutely.
little bit? And I just wanted to say, and I kind of touched on it in the very beginning, but remember that the largest category that I spoke of was our doubled up families, right? They're not going to count so doubled up is not a category of HUD. It's not a category that's recognized by HUD. So all of those families, they're not going to count. And a lot of it's probably going to be because they have a roof over their heads, although we talked about, like, it could be a garage, it could be sleeping on a mattress in the kitchen. It could be just sleeping on the floor, or maybe even have a tent popped up in the backyard. Okay, and maybe I would throw that in a different category, but I mean, it's still doubled up, even if they're in a tent in the backyard, because they're living with someone, whoever this someone is. The other category is hotel motels. That's a challenging one as well, because if a family is paying for their own hotel, then they do not count for coordinated entry services. They do not count. So they also would not count as homeless because they're paying for their own hotel. Now, the minute that a nonprofit or an organization, which some people might say is a housing hack, like, don't tell them you're paying for your own hotel. Tell them that an organization is paying for your hotel, because then you can count on coordinated entry. Then you can receive services, okay? Because if you say, I'm paying for my own, even if it's your last dollar, even if you lost your house in a fire and maybe you're in this hotel because you've lost everything and it's the last little bit of money that you have, you do not count on the coordinated entry list. So those are two categories, McKinney-Vento, that would not count. Now, shelters and transitional housing, well, shelters should count. Transitional housing, probably not, because now you're in some sort of housing, even if it's temporary. Unsheltered, yes, that should definitely count, even if you're McKinney-Vento. And then unaccompanied youth also are not probably going to count because they're staying with someone, because unaccompanied youth are usually doubled up. So maybe if you're unaccompanied in a car, but then you need to be over the age of 18. So you can see how problematic those numbers become as you talk about what counts and what doesn't count.
And every program has a different threshold. Rochelle?
And this unfortunately keeps the cycle and the generational cycle in unhoused situations, because there's not enough funding to sponsor these affordable housing. There's not enough places to house them. And then with the outlooks of, you have to pay your deposit, you have to pay the administration fees. People don't have that. And if they're unable to live in a house and now they're unhoused, many of them lose their jobs. And then they're out working at McDonald's or fast food or selling their bodies, right? To make ends meet. And they're not able to sustain their housing. So breaking this cycle is what needs to happen. But everyone keeps talking about it needs to be this, we need to do this, we need to have the funding here, we have this large funding over here. But it's not getting to the people that need it. And conversations keep happening and nothing is being done.
I think restating what you're talking about breaking generational cycles of houselessness and insecurity. And so I think Mayor Ned kind of spoke to the siloed nature of the institutions that are all trying to solve this same problem. And I want to say something radical: universal basic income. That would really help a lot of people. And then also, monopolies are evil, but do a monopoly for good. Everybody who's doing social work, all get on the same page and apply for the same grant at the same time, maybe under one name, so that we can get a bigger influx of funding. All these different organizations, we all have our own data that we're researching all the time, and there's so many conversations happening, a mind-numbing amount of conversations. And honestly, without the people who are most impacted, I would just say, as a housing insecure child to a housing insecure adult who now is a front-facing person, it's easy to come to conversations and try to represent others, but knowing that my situation was not so bad that I'm not the others, right? And so how do we break these cycles? By reducing the stigma. And again, I want to highlight Mayor Ned. He was really talking about that. We're not trying to stigmatize people, but we do want to help them. And then how do you help someone without a savior complex or without putting that cape on? And so there's a lot of unlearning for us to do. And I think going from an independent society to an interdependent society would really change some of that conversation. And I just want to also thank everybody, because I got to go pick up the kid from daycare.
Thank you very much for coming down.
Thank you.
So one of the things when we talk about the generational cycle, right? Now, I'm not McKinney-Vento, so I don't have the actual updated data on this. However, when we talk about individuals who are children that experience homelessness, they are 2-3 times more likely to learn skills in that setting and become homeless as adults, right? So we're talking about adults now who did not enter this cycle because of drugs or alcohol or mental health, but because of the fact that as children they experienced homelessness, and now because of the fact that there is a cycle, they experience it as an adult because they're not fully aware of how to access all of these skills and all of these resources. And on top of that, when we have foster kids who are housed the entire time are 3 times more likely to leave foster care directly into homelessness, especially because of the fact that our Age Out program has only been around since 2017. One generation of foster kids only have experienced the fact that after you age out at the age of 18 from foster care, you can get services like college tuition or rent as your first move out place up until the age of 24. And we have individuals who come across our desk that were never told up until they were 24. They were 18 and they got kicked out of their foster care house, point blank, and then nobody came and told them that up for the next 5 years, they were able to receive services still. So when they came back to me at 26, they were like, we don't know what to do. We've been on the streets for 5 years. And I'm like, I wish you had come to me 3 months earlier because then I could have helped you. But now I have to put you in this other system that isn't designed for your escape. These are generational, these are cycles that continue, that again, have nothing to do with drugs, alcohol, or jail. We have yet to touch on drugs, alcohol, or jail, or mental health. We have just talked about children and family, and we have already discussed at least about 50% of our unhoused neighbors. At no point have we said that these people deserve jail. At no point have we said they are all a problem with mental health, they are unclean and undesirable to have, and they're not able to take our love. Did you have something you want to jump in?
Yeah.
I saw you grab the mic. Go for it.
So just kind of want to jump in like on stigma and stuff like that. This is kind of a rhetorical question for this room, but what does homelessness look like? Okay, none of us put a definition on it. And I'm just going to use my example. It was super hard losing everything after I worked my tail off to get it. And the only thing I did wrong was go to try to find purpose, right? But if you looked at Darius when he showed up to work, nobody knew what was going on. I had a red convertible, I had a truck on 22s, and then I had a Honda on 20s. But nobody knew that I was arguing with the repo man to try to keep it so that I wasn't embarrassed, right? And so that's one of the things that we have to, for a school district, talk to our staff about. Just because somebody pulls up in a Mercedes, you don't know what their lifestyle is, right? You have no idea what's going on. There was something else you said that I wanted to point out.
Oftentimes, like, we see our kids that have the cell phones and the shoes, because those are things that their parents can get, that they'll often prioritize those expenses so that their kid can feel normal at school. And then I've heard teachers and other parents be very judgmental about that. Well, if they can afford shoes and phones, maybe they should prioritize food and this or that. And it's like, you're missing the point. Kids want to feel like they fit in. Kids don't want to be stick out like a sore thumb. And good parents will do whatever they can to help their kids blend.
Yeah.
I do want to point out that right now, I think the payments on a Mercedes is less than the payments on a house. And honestly, if you've got a warm place to stay that's dry and has an air conditioner in this heat, that's still safe. And we can't judge people who are paying more than what we would necessarily pay for a car, but it's still far less than it would be for rent or a mortgage.
Yeah.
Because it's an option. It's an option in this storm.
Yeah. The last thing I want to say is just about when we talk about the generational cycles and everything. I have an 18-year-old son that just graduated from high school, and one thing that really hit me is the world that he's walking into, right? He can graduate with a degree. In 4 years, he could graduate with his master's, and where's he going to get a job and being able to afford a place to live, right? Without depending on me and his mom. And so these are just things that I'm looking at now because I'm living it and just saying, yeah, my son's a great kid and he's been very successful. And if something happens to my family and if we don't have the right life insurance or whatever might be in place, he qualifies also, and he's not on drugs. He doesn't have the mental health stuff. So it's just, how do we erase the stigmas and stuff like that and really start having conversations? And I remember, very last point, we got to bring the right people to the table.
Right.
It's fine for us to get up here and talk about it, but if we don't have the people that are living those situations and saying, what is it actually that you need? We're throwing darts at a target that we can't even see. I did have a relative who was experiencing homelessness, but he wanted to because he didn't trust the system of being in a house. So it's like when we could get him shelter, it was going on to have a conversation. Where do you want to be? What does help look like, instead of telling him what help looks like?
So on that, I want to point out that specifically in Pierce County, we have only recently been offering some of these services because this is kind of a new system. Up until just before COVID, we had programs like Freezing Nights, which was a collection of churches that all acted like a rotating shelter. The county itself did not have to participate in a lot of these discussions until Freezing Nights, the churches involved in Freezing Nights crashed. And it crashed due to harassment, due to not getting paid back for the services that they needed to from the county level, and low volunteering. When we talk about somebody who is, I mean, honestly, at some point we do have to talk about the fact that homelessness does include mental health and substance use. It does include addiction, right? Because sometimes it's just about trying to stay warm, and I'll tell you that drinking keeps you warm. It might not be a good thing to do, but it does. And we do the same thing with trauma. We do the same thing with mental health. We do the same thing with interpersonal relationship battles, right? We talk about what does it look like to be homeless, but the truth is that if you leave your house because you're in a fight with your spouse or your parents, for that time, you're homeless. If you take your car over to the local Walmart and park there because you don't know where else to go because your spouse or your parents kicked you out and you just need to be out, that's homelessness. And the thing is that when we talk about response and enforcement, the individual who is in that car for that single night is going to experience the same enforcement regardless of what the law states about building a tent. They will come up to your car and be like, you're not allowed to camp here. And you can argue and say, well, I'm just here for the night because they don't care. They've heard stories like that a million times, and they're going to reinforce it the same way as it goes. We talk about all of us are a paycheck away from being homeless. No, we're a fight away from being homeless. We are a miscommunication away from being homeless. We are a missed bill, but not just like a bill that's going to make us actually homeless, but we just need to be out of the house for a night. That counts, right? If we are homeless for a night or if we are homeless for 10 years, this is still homelessness. And how we respond to that should be equal across the board with compassion and with resources. And it is the resources that we're all up here trying now to navigate. But when we talk about the mental health aspect, because that's all anybody sees anymore, is drugs and mental health, drugs and mental health. They say every person on the streets is a drug addict, and they'll try to create a little bit of an allowance. They'll say maybe that drug addict is because, or that drug addiction is because of the fact that they're on the streets, but they're still all drug addicts. I don't care. People have struggles with substance all the time, whether they are homeless or not. They still deserve compassion. They still deserve an escape from that issue based on their own self-identified needs. If somebody says, I can't quit drugs because I haven't talked to my mom in 10 years, my job isn't to put them in inpatient. My job is to sit down with them and make that phone call to their mom, because maybe that's all they needed to push across. So when we hear people talking about how the system is coming for us, the system has decided that drugs are no longer illegal, what they're talking about is something called the Blake decision. At the other town hall that I mentioned a lot, they'll talk about drugs have been illegal for 2 years. That's not true. What happened was a single drug-related charge was invalidated because it turned out to be unconstitutional. The act of having drugs on or near you in Washington state was considered a felony. Somebody could drop a drug next to you. You don't even have to see it. You're just in a park, enjoying your day. The police walk by and see it, and all of a sudden, bam, you are a felon. And now because you're a felon, you have to lose your job at the school. You have to lose the ability to rent an apartment. You've lost the ability to get good credit because somebody put drugs near you. That's all it took. And so when the courts during the Blake decision stated that there is a burden of proof, that you have to show that somebody actually had those drugs or that they belong to that individual, that canceled our drug felony law only the simple possession law. The act of it's on or near you. Not that you have mass amounts of drugs, not that you're dealing drugs, not that you're selling drugs, not that you're moving drugs from one place to another, not that you're making drugs. None of those were affected by this new law. Only simple possession. And that only existed for 3 months. And that is because we had to have an immediate emergency legislative session in order to replace that law, because that law was found to be invalid and unconstitutional. You'll hear people say they decriminalized it. They made it legal. Drugs are legal across the board, and all drug addicts need to be taken to jail, and all people who are homeless are drug addicts, so they all need to be taken to jail. They're full of shit.
It doesn't fix the problem.
It doesn't fix the problem. It doesn't. The idea was to create diversion programs. You find somebody who has just come across drugs for the first time. Historically speaking, here in Puyallup, the police used to tell us when we were kids, if I catch you with pot, give me the pot. I want you to come talk to this church. This church is going to get you straight. If I catch you with pot again, though, I'm going to give you a charge, right? That's it. That's all this new law stated when we did the Blake decision. It stated the police had the power to go, hey, I'm going to take these drugs away from you and destroy them, but I want you to go talk to this other program. That's diversion. Diversion is historically effective in our area because the police here used to have entire programs based on it. You find a kid with drugs, you don't ruin their life. We have felons now that are only felons because they had a dime bag on them that they were holding for a friend, and now they're homeless. This is the homeless and recovery part of this conversation, is that there is so much misinformation going on out there where people are purposely demonizing our individuals that are homeless, or our individuals who are in mental health, or our individuals who are struggling with substance use disorder, because it's easy to otherize. It is easy to put them all in one group and say, if we get rid of one, we get rid of all. But the truth is that all of these people are our community members. And we're going to come at it as we do, with new processes, with new resources, and new approaches. Sometimes it's going to work. Sometimes it's not. When we talk about permanent supportive housing is supposed to be one part of the puzzle. Permanent supportive housing is not supposed to be an across-the-board cure for everything. But now that we're losing permanent supportive housing, the rest of our puzzle pieces don't fit as well. If we take some people and we say, okay, you don't need that much mental health care. I'm going to put you in permanent supportive housing because you do need to be attached to something. And I want to make sure that I know that you're in a safe place while we connect you to that. Some people that doesn't work, and we put them in adult family homes because they need one-on-one staffing. For some people that doesn't work, so we have to put them in the hospital because they need to be in a safe place. Some people are participating in criminal activities, and that criminal activity itself, such as stealing, such as building a shelter in a park, such as attacking people on the streets, those are standalone crimes that people should be charged with, regardless if they're homeless or not, and it should not be attached to homelessness. If a homeless individual steals because they're hungry, I say let them. But I know that the law states that they are now being charged for stealing food. That's the law. We do not compound that with the fact that they are homeless and say, now you get double time. Anybody else?
I just wanted to jump in on a couple of things. We talked about the by name list, and you know, if an individual is trying to access services, how demeaning is it to have to give your name and your information to 15 different places and trying to track down the services you need. We had a talk about there not being many services in Puyallup. Well, we've got Helping Hand House, we've got Salvation Army that has a resident facility, Sharon Care House, Step by Step. We've got Food Bank. Good Roots has a food locker up at Pierce College. The Episcopal Church has lunch programs. We've got a lot of stuff going on here. How does somebody that's unhoused find this stuff?
Right.
You're too stressed to figure out all this stuff.
And how do you get from here to there to you know, if you want to access Good Roots, you got to go up to Pierce College. If you want to access New Hope, you got to come downtown. And you know, transportation is not a simple thing. The other thing, you know, those are just some things I wanted to point out, but the other thing, you know, we've got this URA program going across the county, and guess who's serving on that URA? It's people like me. I don't pretend to have the answers to homelessness. Folks like Darius here are the people that are working hands-on with people experiencing homelessness. He's talking to them day by day, and the people themselves know better than Darius does. But if we expect the URA to cure all our problems, I'm pretty skeptical, because I don't have the answers, and I don't think they do either.
Matt?
I just want to point out, sorry I misspoke earlier. I didn't mean to.
No. So here's the thing, Matt. I want to point out the fact that I think you know that I spoke at County Council recently.
Yes.
In that conversation, Dave Morrell stated that there was only one service, and he did not talk about. He didn't talk about New Hope. He said step by step. He said step by step was the only service for parents. So it isn't you that misspoke. This is part of the problem, is that, as everybody on here has said, how do we tell our people what's out there? Because our people don't know. If we don't know, half the time, we don't know each other's programs. If we don't know each other's programs, and this is what we do 80 hours a week, we can't expect our people to know. We need to do a better job of having bigger conversations that aren't just put them in jail. We need to have conversations about, like I said with 988, putting the posters out. We're having a conversation here where we're doing a lot of information drop, and we're having back and forth. We have both elected officials and people running for office that are here having actual conversations that are non-judgmental, non-assumption, and not making shit up, right? We're actually trying to do the best we can. Janice?
So just a question, I don't know if anyone has it. So I know there's constant talk about, everyone is mental, has a mental health disorder or the addiction. What about those who are disabled and seniors? Does anyone have any data on that? Because I tell you, they call in every single day to Family Promise, and they don't have enough money to survive.
So there is no good data, because of the fact that specifically when it comes to disabilities, we are definitely talking about that healthcare versus homeless management system, right? But I do know for a fact, and I can pull up some data about it later, that we have a significant issue right now with senior citizens spiking in the homeless population, because it's directly tied to housing and the housing market. We have individuals, I found my teams in King County, we found like 20 senior ladies and there was always the same story, that they had grown up in this culture of taking care of the husband. And when they got married, they took care of the husband did the bills, the husband went to work, the wife stayed home. We hear about it all the time still, but what happens when the husband dies? No matter what savings they have built up, the husband was the one that was doing the work. The husband was the one that was doing the bills. And when that husband dies, the wife is now alone for the first time trying to figure out the bills, that she doesn't know to call Jimmy down at the bank about the mortgage. She just knows that the bills go out. And so what we found is these older ladies that their husband died and they didn't know how to pay the mortgage, so they got evicted. And then they didn't know what to do because they've outlived all of their friends. So they moved into a hotel. And then that hotel, charging $80, $90 a night, slowly drained out their savings. And after a year of living in a hotel, they are now broke and homeless, but they don't know where to go. So they move into the stairwell of the hotel. And then the hotel calls my teams, the crisis teams up in King County, and says, hey, we don't know what to do. This poor old lady, she's just here, and we've tried our best to keep her here. We gave her a room for free for a few weeks, but there is no exit strategy. And this is a common story, not just with the wives and the spouses, but when we talk about disabilities like intellectual disabilities, where we have a son or a daughter who lives at home and the parents pass away. All of a sudden, again, we have this individual who did not know how to do the bills. No matter how high acuity or low acuity or high needs or low needs that individual is, if you're being taken care of by somebody else and they pass away, you don't have the skills to pay those bills, and even if you do have the skills, you don't have the knowledge of which bills to pay when. And so we have disability spiking in our homeless system. We have mental health spiking in our homeless system. We have senior citizens spiking in our homeless system. And on top of that, we have recently lost Western State as an actual hospital. It is now just a civil commitment center. And what was supposed to happen was that we were supposed to be taking folks out of that area or out of Western State and putting them into 16-bed diversion facilities that were supposed to be located throughout the community. Those were supposed to be in place by 2023 and were never established. And so we have like maybe 1 or 2 of them, but we were supposed to have several in every community.
Just wanted to add, this is my last soapbox thing. First of all, just going to you because you said you apologized twice. Don't apologize, because at the same time you're educating. I had no idea about New Hope, right? And we don't know what we don't know. So you educated people and we learned at the same time. So don't beat yourself up. The other thing I was going to say, well, sorry, lost my whole train of thought. Yep, it was a soapbox. Oh yeah, I remember now. So I'm also on the board for the Tacoma Rescue Mission, and one of the issues that I see is like, yeah, we talk about wanting to help and all those kind of things, right? For a good neighbor village, I'm just gonna be transparent. I went down to Austin in the very beginning. I don't know what in the world it is. So I go down to Austin, Texas. I see this whole model, and I'm the kind of person where I'm not gonna sugarcoat things. I want the real story. We're going through a little trolley. They're giving us the little fantasy story and everything, and I jump off and get left, and I'm just talking to the people that live there. And I'm like, what is it like? Yeah, they're giving me some of the bad stuff. But they're also, the guy that I talked to had been homeless for over 10 years. And he went in, he was like, oh, I gotta be back. He went and ironed his shirt, put on his little cowboy hat, his jeans, and his boots, and he was so excited to go to work on that campus. And I sat there and I was like, thanks for being real with me. Thanks for telling me the bad and the good. Mm-hmm. But what I saw in him was this man was excited to go to work. So I grew up in Spanaway. When I came back home and we started, I'm learning as I go, right? I'm learning about all the political stuff behind it, and we're talking about it and everything like that. And I just kept saying, okay, we talk about it in Spanaway. When are we going to do something? When are we going to get some kind of support out here in Spanaway? And then they said, okay, we're going to build the Good Neighbor Village out there. I honestly was super excited to be like, yeah, something for my hometown to help people. And then I saw the other side and started hearing the other side. And I'm like, oh, yeah, you want to help, just not next door to me. So we're going to keep talking about the problem and stuff like that. And then we're going to say, oh, yeah, I just don't want it in my backyard because of all the assumptions and stuff like that. So here's what we end up in. A circle of talking in a room of 6 people. So that's the end of my soapbox.
That was great. I just want to underscore, yes.
I just want to say just one little thing. So one thing that we have to be accountable to is that homelessness is a $1 billion venture, right? And we're reinventing the wheel a lot of the time. Whoever's been here the longest has the biggest pile of stuff. So, you know, somebody's a golden child in their community of, oh, I've been doing this for a really long time, that's great, I'm happy for you. So as you continue to be 20 years, 30 years in the homelessness business, you know, we have to truly evaluate how we're still maintaining and increasing numbers, and then saying, well, then we've got so-and-so and such come in, and then they're doing this, and so-and-so and such, and, you know, but what we're, you know, then we see people burn out, and then we see that things happen, and I heard the trickle up, and that's kind of was the point of Family Promise. Jess and I, as co-founders of that organization, wanted the trickle up approach. You know, you help the families, which helps the schools, which helps the government, which helps, you know, the world, was the idea. You alleviate the pressure. So as we continue to try to find these solutions, you know, that kind of stuff starts from within. Like, what's Jim Bob's homelessness agency up to? Like, because they've been in the game for 15 years. What's Sally Sue's homelessness site up to? Because she's been in the game, you know, 35 years. And then here comes, you know, Sam and Jess's joint homelessness place. And they've been in a couple of years, and there's some cool stuff happening. And it's working. And that's okay that it is. However, is that sustainable? And how is it going to continue to be sustainable as opposed to the 57 other homelessness things that have been happening throughout the years. So I just need to name that, right? Because Sally Sue and Jim Bob and all of the other homelessness agencies are still functioning. They've been here a long time, and they've been applying for the same billions of dollars. The Hunger Games is what I call it, the RFP process. And so we're all applying and doing all, and the things. And it is hugely competitive, and it shouldn't be.
Right.
Because if we have the same heart for the same folks to do the same helping, then I'm not competing with you, honey. I don't need to be better at helping homeless people. I just need to be helping homeless people. And as we recognize, as Kenny keeps talking about, the mental health issues, what we do know is that homelessness is not a homeless issue. Because as soon as we place people in housing, then the problems start. Because then they have to deal with drug abuse or mental health issues, or their kids are dealing with things, or any type of trauma. And then maintaining their home, plus, we've seen folks that went into housing and couldn't live in their house for 6 months. Because housing was like, oh, I don't think I can swing that. And they go back out on the street because that's where it was comfortable. We talk about these families. We've got a safe parking site that we've been running almost 5 years, and we've seen hundreds of people come in. And the parents are scared because they don't understand that being homeless is not a crime. And CPS, they think that's scary. No, honey, CPS helps you. CPS will get your kids clothes. CPS has diversion funds. CPS has a lot of things available to you to help you. So, the feasibility studies, I'm so tired of I can't stand a feasibility study. I don't want to do that anymore. So we can come together and we can do all the things and we can have all the conversations, but, we've got all the same agencies doing all the same stuff, and it doesn't change the way that it needs to change. So I needed to, I'm Pastor Samar Jenkins, Burbank pastor of Family United Methodist and Already United Methodist Churches and co-founder of the Family Promise Puget Sound. I should have said that from the beginning. But I just needed to name what that looked like, because we intended to not reinvent the wheel. We wanted things to be different, and that makes us hugely unpopular, and I'm okay with that. But also, we need to name that this is a business. Homelessness services is a business, and it shouldn't be. And that's all.
So, one of the things that you all might have heard me say, and we're going to start wrapping it up here, but one of the things that you all might have heard me say several times tonight was a few years ago, 5 years ago, 2019, 2017. For example, CPS was a completely different program until 2017. It was only handed over to DCYF in 2017. And in 2018, I wrote the reports because they didn't know they were the ones you were supposed to call in an emergency. They asked me what that was all about, and I had to write them a report for them to actually create their new process. Everything has changed right before COVID. And COVID stalled us out in a lot of things because they were all supposed to happen with CPS being taken over by DCYF. One of the things is that our families do not know that Child Protective Services is no longer an enforcement agency. It is now a backdoor to DCYF. It is just the people who go out and do the direct outreach. Yeah. Almost everything that we're talking about was supposed to change in 2017, 2018, and 2019 with a deadline of 2023. When we talk about the schools and we talk about truancy with the BECA bill, that was supposed to be eliminated by 2023. The use of valid court orders to jail children for missing school or to punish their families was supposed to be eliminated by 2023, but because of COVID, it somehow just disappeared. With CPS taking on new roles that were supposed to be in place by 2023, because of COVID, nobody saw that. With the mental health diversion facilities that I was talking about, the 16-bed community-based diversion facilities that were all supposed to be in place by 2023, COVID interrupted that. When we talk about the regional approach and taking a new effort and new approach to all of these services, It's all happening right now. All of the changes, all of the laws, all of the things, even the Blake decision, which is that law about drugs, just happened. Everything is happening right now. And so as we, as elected officials, as service providers, as people who want to sit at the leadership table and have these discussions, everything that we are about to become as a region is happening right now.
I just wanted to underscore what Pastor Smar was saying about the RFP and grant making process and grant process in general, just making funds more available to organizations and not making it so hard and scrutinizing organizations, and just that money needs to be spread equitably. It really does need to be spread equitably. When we talk about, county funds and state funds, maybe not some federal funds as federal funds, but when we're talking about funding that's here in our county, in our city, we just need to make sure that, yes, of course, there needs to be some sort of process. Yes, please have your 501c3 or whatever documentation you need, but please don't make it such a hard process that organizations either run away from applying altogether, or, they can only serve for a certain amount of time. Because the worst thing that you want to see an organization do is start up something and then not be able to finish it. And so many times we'll see such great homegrown organizations that are doing great work, that are serving in community, exactly the people that Darius are talking about. They have lived experience, they look like you, they understand your story, and you know what? They go away because they are not able to continue to serve our families or to serve our homeless population. So I think that that's super important. The other thing that as a liaison I've always wanted to see more of is more caseworkers. I want to see people walk alongside families and walk alongside people as they're trying to understand how to navigate systems, because I don't think there's enough system navigators out there. I don't want to see a family be passed around to 5 different organizations or 10 different people to have to continue to explain their story. And we already said that up here, but there needs to be more system navigators that spend more time with families to help them get on their feet. And then Pastor Samara also said it, once you get housed, that's one part of it. So it's education. It's continuous, right? And it has to be happening at all levels. And I just think that there's such a divide in how this is happening, and we just have to come together. So this is a great step towards doing that work. And I wasn't at the last McKinney-Vento town hall, but thank you so much for having us, and thank you for bringing us together. And I hope that we can diversify who's up here, and that we can continue the conversations and have some tangible and actionable steps that come out of these great conversations.
All right, we do have to wrap it up. Half the people in the room have left, but
You got it on video.
it's all good. I appreciate everybody here tonight. We can continue the conversation in the parking lot, and that's okay, but we got to get on the road.
And we're done.